Most women don't know there are actually two stages of perimenopause, and you need to know which one you're in order to get the right treatment plan. In this video, I want to talk about the early versus late stages of perimenopause. How do you know which one you're in? What does this have to do with treatment? How does this affect you? What is perimenopause? So perimenopause is actually the transition phase up until menopause. So menopause is when you've had 1 year without a period. But perimenopause is this transition that can be 4 to 10 years leading up to menopause. And I call it this kind of zone of chaos because your hormones are going through this roller coaster, which affects how you feel, and it affects the other hormones. This can actually start as early as your late 30s. You could be 35 starting perimenopause or 39. In fact, a lot of women will notice the very first symptom of perimenopause is that their cycle starts to change. They start noticing that instead of having a 28-day cycle, they're having 35 or 40 or just kind of randomly skipping it this month. And that's actually a very common sign of perimenopause. So now that we kind of know what perimenopause is, let's talk about the stages of perimenopause. Why does it matter? What do you need to know? Let's talk about early perimenopause first. So some signs and symptoms of early perimenopause. So breast tenderness, heavier than normal periods, waking up at like 4 o'clock or 5 o'clock and can't get back to sleep. Feeling agitated, irritable, annoyed, kind of noticing you're getting mad at everybody and yelling at your husband, yelling at your kids. This is all symptoms and signs of early perimenopause. And you could be having a normal, regular cycle. So your cycle could still be 28 to 30 days, but you're starting to experience these symptoms and definitely more prominent in the second half, in the luteal phase. So why is this happening? Well, when you go through perimenopause, essentially the lack of follicles that are able to be developed because you're now having less and less follicles available, because when we're born, we have the eggs that we're going to have for our entire life. So when we get it into a certain stage, then we just stop recruiting those eggs to be able to be ovulated. So this lack of ovulation causes low progesterone production or no progesterone production. And progesterone is this hormone in your body that helps you get to sleep, stay asleep. It helps calm you down. There are other hormones that are kind of getting you excited, and progesterone calms you down. It's a very calming hormone in general. So you start experiencing symptoms of low progesterone. Things like heavy periods, because the uterus is being thickened by estrogen and progesterone is not there to kind of calm it down and say stop. So basically, when you have thickening of the uterus and progesterone is not there to say calm down, stop making this so thick, then you end up having heavier periods. You get woken up at 3 o'clock or 4 o'clock or 5 o'clock in the morning because, again, progesterone works to the GABA receptors to calm the brain down, to get you to sleep, to stay asleep. So when you don't have this, you wake up and you can't get back to sleep. It also doesn't, without progesterone, you don't have that calming effect. So women notice they're more anxious, irritable, panic attacks more often. You start noticing these mood changes that are something you haven't experienced before because of this lack of progesterone. And here's the catch. Estrogen, even though estrogen is, not declining at the rate that progesterone is, it's actually going down in this roller coaster fashion. So there are times when your estrogen is, for lack of a better word, high, even though that's normal for you, normal and low. So doing blood work can be very confusing. This is often why most doctors don't recommend doing blood work in perimenopause, because you'd almost have to repeat it and see where they are, because at any moment their estrogen and their progesterone levels could be all over the place. So then what can you do? Well, in early perimenopause, you can start tracking your cycle. There are fantastic apps that you can help track your cycles and start tracking your symptoms and figuring out where are they occurring in your cycle. Are they in the early part, late part? What symptoms are you having? What are the things that you're going through? And you can bring that information to your doctor, because then they know what type of hormone replacement therapy, if you choose to use so, that would be personalized and make sense for what stage that you're in. But basically, you need to know that you're in this early phase of perimenopause so that you're not given stuff that's not going to work. So for example, oftentimes in early perimenopause, I give patients progesterone only without the estrogen because their estrogen is still fairly high. And so I don't want to make symptoms like breast tenderness worse. Okay, so that's early perimenopause. Now, late perimenopause is that stage right before you hit menopause. And late perimenopause, usually that's when your cycle starts to change. You start noticing shortening